Good afternoon, everyone. Myself Jamika, and today we are going to learn about generalized anxiety disorder. The definition of generalized anxiety disorder is an anxiety disorder that is characterized by excessive, uncontrollable, and irrational worry about everything. This is not specific about one object or situation. This is a generalized anxiety. Generalized anxiety disorder is a common chronic disorder characterized by a long-lasting anxiety that is not focused on any one object or situation. Like if you are sick, you will be having anxiety. If you have fear related to something, you will be having anxiety. If you don't have time management, if you have stress, if you have any of this problem, you may have anxiety. What are the epidemiology of generalized anxiety disorder is the usual age of onset is variable from childhood to late adulthood, with the median age of onset approximately 31 years. Women are 2 to 3 times more likely to suffer from generalized anxiety disorder than men. It means it is very common in women. Generalized anxiety disorder is also common in the elderly population, those who are above 60 years of old. Next, we are going to see about the causes. So, what are the causes of generalized anxiety disorder? The first one is genetic. Next is brain chemistry. Generalized anxiety disorder has been associated with abnormal level of certain neurotransmitter in the brain. Environmental factors, trauma and stressful events such as abuse, the death of loved ones, divorce, changing jobs or schools may lead to generalized anxiety disorder. Now we are going to see about diagnosis or diagnostic criteria, how you can find out like person is having generalized anxiety disorder or not. So first, we need to assess the excessive anxiety and worry occurring more than 6 months. Suppose a person is having anxiety, worry more than 6 months, then we can consider that patient may have generalized anxiety disorder. The person finds it difficult to control the worry. Person will not be able to control the worry. Next is the anxiety and worry are associated with 3 of the following 6 symptoms. Only 1 item is required in children. So the first one is restlessness or feeling keyed up, being easily fatigued, irritability, muscle tension, difficulty falling or staying asleep, or restlessness, unsatisfying sleep, difficulty in concentrating, or the mind is going blank. You cannot concentrate on particular thing if you are doing something. Your mind will be blank if you have generalized anxiety disorder. So next we are going to see is symptoms of generalized anxiety disorder. So first symptom is physical symptoms. Physical symptoms includes tachycardia, chest pain, yawning, dry mouth, nausea, abdominal pain, diarrhea, tension, headache, tinnitus, sweating, dyspepsia, that is called feeling of fullness with very little intake of food, dysphagia, difficulty in swallowing, sexual dysfunction, and dropped beats. Next, we are going to see psychological symptoms: anxious mood, worry or fear, irritability, feeling restless, nightmare, feeling of being unable to cope up with the situation. Next, we are going to see about the treatment of generalized anxiety disorder. So the treatment is combination of both the things, pharmacological treatment and medicine and therapies. So the first pharmacological treatment is benzodiazepines, which is an anti-anxiety drugs. Common benzodiazepines includes Librium, Valium and Atrin. antidepressants such as Paxil, Prozac and Zoloft. Next, we are going to see what are the therapies we can use. Psychotherapy includes cognitive behavior therapy as a psychological method of treatment for generalized anxiety disorder, which involves a therapist working with the patients to understand how thoughts and feelings influence the behavior. This is the cycle, how the anxiety produced. Next, we are going to see the prevention, how we can prevent generalized anxiety disorder. Anxiety disorder, like generalized anxiety disorder, cannot be prevented. However, there are some things that you can do to control it. So the first one is stop or reduce your consumption of products that contain caffeine, such as coffee, tea, cola, chocolates. You need to avoid all those things. Exercise daily and eat healthy and balanced diet. Practice stress management techniques like yoga, meditation. Support after traumatic or disturbing experience. So today we have discussed about generalized anxiety disorders definition. Then we have seen the epidemiology of generalized anxiety disorder. Then we have seen the causes, which is genetics and brain chemistry, environmental factors. Then we have seen diagnosis. Then we have seen the symptoms, includes physical symptoms and psychological symptoms. Treatment includes combination of both the things, medication and therapy. In medication, we use benzodiazepines and antidepressants. In psychotherapy, we can use cognitive behavior therapy. Then we have seen prevention. Now here we are completing our topic. Thank you.